Jason Harwin, welcome to PolicingTV. Today we're at the fantastic Canada House in London for the latest National Police Chiefs Council's Promising Practice around drugs. I'm absolutely delighted to be joined by two of the most senior individuals in policing that have got the responsibility about addressing the drugs linked into the harm to hope strategy. Firstly, Chief Constable Dr. Richard Willis, and secondly, Mark Lay, who's the National Coordinating Lead.
Good afternoon, Jason.
So, Mark, firstly, do you want to tell us about what today's about?
So today is very much, it's addressed as a promising practice event, but key to it is bringing together all the UK force drug leads, so which is normally at your superintendent, detective superintendent, DCI rank that's got responsibility for the tactical delivery of the drug strategy within forces, but has also got that strategic oversight of the implementation of the recommendations from Dame Carol Black's Harm to Hope strategy. So today we had all forces represented from across the UK. We also had representatives from the judiciary, so this was around family drug and alcohol courts. We had leads from the Joint Combat Drugs Unit. Deputy Director Marcus Starling came from the Home Office Drugs Misuse Unit. We also had people with real life experiences, survey use experience. So it's that whole spectrum really that we wanted to address today of where we are currently with the Combat Drugs Partnerships, but also what's coming over the horizon. And in particular to have from the NCA an opportunity to talk around nitazines, and it was fantastic to hear around the progress we were making around some of the mapping around near miss data, so understanding of drug related deaths. So Promising Practice event is very much about bringing all leads together, all partners together, that all have got a part to play in restricting supply, reducing demand and delivering that world-class treatment services. So really good to have everyone together, and we're very fortunate in having through the relationships we have with the High Commission of Canada, that they're able to pull together a really good event today for us in terms of the location, but also in terms of facilities. So a really good day for leads around the NCA, Border Force, law enforcement, but also other partners as well.
So again, like you say, there's lots of people have been here, about 140 attendees.
140 people today, yeah.
All forces just about covered.
Yes, all forces, yeah.
In terms of what you're looking to achieve from the day, Mark, what's the key things we're looking to achieve?
Key things is people understanding where the focus is from government, so understanding where that drive is, understanding what good looks like for policing, so how can you replicate that strategic vision into tactical delivery. So that's really key, but also these events, because they're in person, it gives an opportunity to network with other leads and just discuss, say, whether or not you want to find more about the detail around the drugs focus desks, whether you want to find more detail about who's drug testing on arrest in domestic violence cases, whether you want to share a strategic plan, so because there are all those plans and aids and assistance, so it's all about helping each other really. So just a really good opportunity to bring people together in the same room, put a face to a name and actually engage with people and really help people along that journey in terms of that delivery in force. And
obviously, you like to say this is the second Promising Practice event that's taken place.
Yes, so last year we had one in Liverpool and one in London. So, and then we replicated it with speakers in both locations. But because of, as I say, the generosity of the Canadian MC here and obviously the facilities, we're able to just bring everyone together in the same environment. And what was really key was actually we had leads coming over from PSNI, flying down from Police Scotland as well. So by having it in the capital, it really gave us an opportunity to bring everyone together in one place.
Yeah, thank you. And Richard, obviously you've got the challenge of obviously the responsibility of working on behalf of all Chief Constables, working across the wider system with other strategic leaders to look at the policy and response to the harm to hope strategy. Clearly policing are heavily involved in that work. Can you give us a flavour of some of the things that policing are doing at the minute?
Yeah, our plan, you were the previous leader of course,
yes,
so I've learned a lot from you in terms of that work, but our work at the NPCC is to try and operationalise those strategies set by government. A 10-year harm to hope strategy backed with billions of pounds of funding, that's difficult to break down to an individual superintendent leading on a drugs programme in a particular force. So today, and more generally our work at the NPCC, is to make sure that we can make that link between operational contacts working in forces towards a national strategy. Not everybody's heading in exactly the right direction, but they don't necessarily need to be, as long as those three aims from the harm to hope strategy are precisely at the sort of the forefront of their thinking. How they get there is a matter for those local areas, and so With the NPCC, we try and perhaps corral them all in one direction as much as we can. You do have to respect the operational independence of chief constables, and how they get there's a matter for them. We're there to guide them and assist as much as we can.
Yeah, and importantly, like you say, obviously I was heavily involved in the work before I retired, but clearly lots of progress is being made, except there's always going to be more progress to be made at the same time.
Yeah.
To talk us through some of the things like drug testing and arrest,
Yeah, so we've seen a significant funding increase previously for drug testing and arrest. So we have a number of forces now doing a lot more of that than they used to. The funding's now been withdrawn, but that continues. And so now that the systems and processes are in place, it is now a cheaper thing in order to do. We've lobbied government as well to make sure that drug testing and arrest trigger offences are now increased. So we're now talking about domestic abuse incidents being involved in that as well. Work that Mark mentioned there in terms of the link we're now seeing between cocaine in particular and drug and domestic abuse. And so that's one element of our work. The one which we're working hard on to increase is naloxone rollout across the United Kingdom. We're now up to 29 forces, I think, Mark. We're now deploying naloxone within their forces. So there are some which aren't. And so with the direction from government working alongside those forces that don't carry naloxone, making the case, trying to reduce some of the barriers that they find, and once again creating that link between local chief constables and forces and national government.
And obviously one of the things we talked about today was around Project Adder as well, which again has been running for a couple of years, again acceptance work in progress, but again significant enforcement action, significant diversion activity, and then getting people in treatment services as well. How do you see that going from a policing perspective?
Well, as a principle, it's something that we want to see a great deal more of across the United Kingdom. Officers such as us, and past 2 retired officers in one serving, we've gone through so many doors on drug warrants across 30 years each of police service. That alone will not deliver the results that our core strategy wants to deliver. So it is about working in partnership, and ADA is an example of how you do that to reduce dependency, push people into treatment, as opposed to simply criminalising on every occasion. Of course, sometimes criminalisation is the appropriate route, but making sure there's a myriad of options available to partners locally to draw people out of dependency and away from the criminal justice system as much as we possibly can.
But I think we all recognise the complexity of what we're dealing with though on this. This is not an easy issue to address. It can't be addressed by policing on its own, as you touched on there. It's not. Enforcement's really important. Clearly we need to target those as creating great harm to our communities, but at the same time we've got to try and address the need, which again is not a lot of the work that the service and the wider parts are at the minute. So certainly for viewers at the moment, we are looking to do a series of episodes coming up over the next few weeks, looking at the issues around policing and drugs. So hopefully we get the opportunity to speak to some of the presenters that's been here today, showing some of the practice that's taking place, but at the same time talk to some of those that have got responsibility across the service about their response to drugs as well. So thank you for your viewing now, keep watching in and look forward to the next episode.